Bezruchka has a very interesting background. For 30 years, he practiced emergency medicine and spent over 10 years in Nepal setting up community health projects and training Nepali doctors, as well as consulting in public health. If you go out to the book table, you'll notice that at least one of the books we have is actually more related to travel medicine and wilderness medicine, and that is often what you find when you Google his name. But in addition to that, he's now a senior lecturer in the Department of Health Services and Global Health at the University of Washington School of Public Health, where he's won the Outstanding Teacher Award and a Faculty Community Service Award. And currently he directs something called the Population Health Forum at the university, a group that tries to engage Americans in questioning why they die so much younger than people in all other rich nations and some poor ones, despite spending almost half of the world's healthcare bill. So, Dr. Bezruchka.
Well, I don't know about you, but I think we all ought to just take a deep breath after what Dr. Mosley presented. I found that incredibly emotionally trying, and I was thinking that what is necessary is a response ability. We need to have the ability to respond in some meaningful way. And I don't know quite where that's going. So in my talk, I want to talk about populations. I had sort of thought after last night of presenting a case, USA, and then I just decided, no, I'm not going to talk about USA. You know the acronym. But she's a very unfortunate sick person. What I want to do is lead you through looking at the vital signs of a country, of countries, try and present the idea that all of us in the United States die younger than we should. We all die younger. There isn't a cherry-picked group that can escape the health impacts of living with the conditions that Dr. Mosley described so well. That is, it affects all of us. So my talk is a downer, I have to tell you that. I want to try and explain this, and I want to suggest that the reasons lie in early life, the conditions that we put in place in society, all of us, that structure early life that are not good for us, and that inequality is the primordial determinant of all of this. And that stress is the key mediator in modern society. I want to present the idea to build on what Dr. Mosley said, that stress is the 21st century tobacco. Finally, I want to present that in everything there's a gradient, namely poorer people do poorly, whether it's their response to medical care done right, or in pretty well every measure of health. And that what we need are social medicines, medicines delivered to society. So, I've already said this, we don't do so well, and that the issues of neglecting early life affect us all. So what about vital signs for the United States or for any country? Just as we take blood pressures and oxygen saturation and pulses and temperatures, these are vital signs for an individual, and as an ER doc, it told me how fast I had to respond. But what about vital signs for a country, for a population? Well, life expectancy at birth, the average number of years lived, is one. You all know about infant mortality. Early life indicators as well, such as low birth weight or preterm deliveries, also maternal mortality. Then various measures of child and adult mortality. And then if you get beyond all that, how many years do you have left at age 50? And what's happening in U.S. counties? Recent research just released. So I want to look at all of those in some way. And in my own frustration about 11 years ago, I said, you know, we compete in Olympic events, and the next ones will be in London next year. Why not have health as an Olympic event? How well would we do? So let's take life expectancy. How many here think that we are on the left-hand side? If we took among countries, how many think we're in the top 15 countries by life expectancy? Raise your hand if you think so. Okay. How many think we're on the right? How many think we're 30 or above? A few hands, okay. How many think we're below 30? That's right. So if we go to our Central Intelligence Agency World Rankings website, where this is our CIA, so their data is probably pretty good. Here we are at 50th. That is, 49 countries are ahead of us in terms of length of life. Now, I don't think this is valid. I don't like this. Here's Gibraltar ahead of us, and it's just a rock. So let's, and there's a number of tax havens up there, tiny islands, Andorra sandwiched between France and Spain. So let's take all those out, and let's just have what I call countries, and here's how we do. 29th, okay? So this is, and some of us, and WHO puts us lower. It sort of depends on what you call a country, and I just want to take things that we'd all agree are countries. So we know that if somebody has a temperature of 37 and somebody else has a temperature of 42, that's a big difference, those 5 degrees. What does 4 years of life expectancy differentiate into between United States and the longest lived country? We could do a thought experiment. We could go back to September 11th, 2001 and do the calculations with and without those 3,000 deaths. Would it make any difference in this graph? No. 100th of a year. So if we eradicated our leading killer, cardiovascular disease, and kept the other disease death rates the same, it would give us about 3 to 3.5 year gain in life expectancy. So if we eradicated our leading killer, we still wouldn't win the gold medal in the Health Olympics. So why? Why? So this is all you need to know. We die younger than people in all these other countries. Well, which country on this list has the lowest proportion of men smoking? United States. Which country has the highest proportion of men smoking? Japan. Everybody knows that. Twice as many men smoke in Japan per capita as in the United States. That's not the reason Japan's so healthy. But it does suggest that we have to look at other factors other than personal behaviors to explain our health status. That, when I learned this about Japan and the United States, I had to unlearn so much that I thought was really true about personal risk factors, and I had to relearn something new, namely what created health in populations, and now we have to do something about that once you get that far. We spend half of the world's healthcare bill. 18% of our very gross domestic product is spent on healthcare, and it's going to go up. So healthcare cannot be the leading explanation for this. So you're pediatricians, a lot of you. What about some other indicators? This is the only indicator that you find published in US government documents today, that infant mortality, that gives you rankings for countries, and they only have selected country rankings. And so this is Health USA, published by the CDC. And back in 1960, out of these selected countries, the United States ranked 12th. By 2006, we ranked 28th. In other words, although infant mortality is declining, it just goes down faster in other countries. And this is available in our CDC publication, but mostly we don't address this. Already you know more than most doctors or medical students. A survey done of medical students showed that about a third thought we were the longest lived, life expectancy, and with the lowest infant mortality. And that tends to be true across the spectrum in my dealing with doctors. Most of us don't know these facts. What about other indicators? Prevalence, premature deliveries. So these are countries ranked by percentage of deliveries that are greater than 22 weeks and less than 38 weeks. Again, we have very high rates of premature deliveries. They're exceptionally high in African Americans. They're off the scale there, and there's a reason for that Dr. Mosley alluded to. Low birth weight turns out to be a critical indicator. The percentage of low birth weight infants is very important. The other thing to be sure, it's not our healthcare system that is, there's something about our healthcare system that doesn't make up for the preterm deliveries. So these are, you have your own handouts there, and you can look at this later, but this is published by our National Center for Vital Statistics, showing that other countries do better with the outcomes for premature delivery infants. The other key thing, as I said, is low birth weight. And we have a very high prevalence of low birth weight, that is less than 2,500 grams, and especially high for African Americans at all income levels, as you pointed out. This isn't a very good sign. We can look at trends. So this is under 5 mortality from 1970 to 2010, and I've just put a few countries on the graph. And you can see that whereas our outcomes are doing better, they're just declining faster. They're just getting better faster in all the other rich countries. I'm always interested in, when I was a medical student in 1971 in a class on health and society, I actually wrote in my notes that in 1951-53, the United States had the lowest maternal mortality ratio of all countries. Now, not only are we not doing so well, our maternal mortality is actually going up. That is, more women are dying from childbirth-related causes in the past decade than used to be the case. Not true in other countries. So if we do a maternal mortality Olympics ranking, what we find is we're right there with middle-income countries, Latvia and Macedonia and countries like that. That's who we stand with in the Health Olympics. We stand with relatively, certainly not the rich countries, relatively middle-income countries, and I think that's a disgrace, and that's something we need to respond to. Some of this gets into major U.S. government documents. So the United States Congress published this in 1993 in International Health Statistics, what the numbers mean for the United States. Namely, if you're a man, age 25, what are your chances of living to age 65 to retire? And how does that compare with the other rich countries? Similarly, if you're a woman, women always do better than men in almost any health indicator. We men have an X chromosome deficiency disorder. We can't do anything about that. So what if you make it, so this is, but nobody knows this stuff. I'm just amazed at this. So what if you make it to age 50? How many years do you have left? Same story as at birth. So these are grim data. This points out that no matter what, we don't do very well. Who's been taking the brunt of this burden? Turns out to be women. Women in the United States have fallen behind the health improvements seen in so many other countries. And so this is a graph of life expectancy, how many years you have left at age 50, from 1955 to 2010 for 6 countries: United States, Japan, France, Spain, Australia, and Italy. And American women were the longest lived in 1955, but notice around 1980 they started falling behind. And that's true for so many other indicators. This is published by the National Academy of Sciences. These data are all out there. Study just released from our Institute of Health Metrics and Evaluation last month showed that if you look at county life expectancy, so life expectancy by counties, you find that some counties have, the red ones do the worst, and the purple and blue ones do the best. And you can see where our good health is, which is in the Midwest by and large. Yes, we don't do so badly out here. The poor health is in the Southeast. We see it for men, we see it for women. As well, the study calculated an international frontier of life expectancy, which was the average of the 10 longest lived countries, and then said how far behind in calendar years are U.S. counties. And what they found was that quite a few U.S. counties were more than 50 years behind in the health outcomes. Our country as a whole is about 17, 18 years behind the longest lived country, meaning that in 17 or 18 years we'll achieve the health status of Japan today. It's sort of like saying, you know, look, they have an iPad over in Japan, but it'll be another 18, and in Western Europe and places like that, it'll be another 18 years before we get it here. Would you stand for that? I hope not. Same thing for health. So our counties are far behind countries in life expectancy, And this suggests that even our healthiest counties don't do very well. And I have some other slides in the handout. What's in your syllabus is a more extended version of slides that I cut down. These are the data for African Americans, where and you only have data where there's a large enough proportion of African Americans in U.S. counties to make statistical statements. Not very good. There isn't any good news in all of this. Dr. Mosley talked about health disparities, and so I want to know, how are we doing compared to other countries? So averages, life expectancy is an average, infant mortality is an average. It masks huge inequities. And so this is a slide from OECD of the dispersion, the standard deviation of mortality rates above age 10 for countries. And from 1960 to 2005, and in all the other countries, numbers are trending down, but not in the United States, and of course we have the highest. So it is very clear that we have the highest health inequalities or health disparities among rich nations. That's also not good. We need to respond to that. Just to put a very macabre number on this, demographers often do funny calculations, and so they asked the question, if the United States had been the healthiest country every year of the last century, if they'd had the best health outcomes every year, how many more Americans would be alive in 2000? And the number they came up with was 66 million more people. That is, we'd be rubbing shoulders with 66 million more people if every year of the last century we'd had the same health status as the healthiest country that year. So why do we die so young? Not because of personal behaviors. I used to harangue my patients about all their personal behaviors. I then came to see it's really they're coping with the stress in society. It's not medical care, as much as I wanted to believe that for a long time. In some things, we do very well. These are 5-year survival rates for common cancers, comparing the United States and Western European cancer registries. And you can see for pretty well all those cancers, we have higher 5-year survival rates, yet we die younger. There's a disconnect there. It's not that we shouldn't diagnose and treat and screen for cancer. As a matter of fact, a while back, I was on I-90 coming into Seattle, and I was right behind this vehicle from Assured Imaging. Detect more cancers, save more lives. It's that simple. Is it that simple? So I'm always after trying to understand, what do the major sources who think about the relationship between healthcare and health say? And so from Dr. Mosley's institution, the University of Michigan, which does some really amazing work, here's this monograph, Making Americans Healthier, Social and Economic Policy as Health Policy. And on page 4, right up at the beginning, they write, as dramatic and consequential as medical care is for individual cases and specific conditions, much evidence suggests that such care is not and probably never has been the major determinant of levels or changes in population health. That's what I've concluded after many years of trying to ask this question. Yes, we should have health care for everybody in this country. It should be free at point of delivery, but it isn't going to do much to improve our health. So we work in a traditional disease approach, right? You try to decrease chronic risk factors to drive down the risk of death as we go from early life to death. And we institute primary, secondary, and tertiary prevention, and we try to do medical interventions to sort of deal with treating diseases. This is a traditional approach, and I would say it's not working. So what's health all about? What's population health all about? Health has been improving over the last century. It's an amazing thing. We've seen huge health improvements, but they're not shared equally. If we remember nothing else from what I said today, remember that poorer people have poorer health, the socioeconomic gradient in health. For everything, poorer people do worse. The key thing that's missing from any discussion today is the importance of early life for our health as adults. So, studies over the last 30 years have pointed out that economic inequality, the kinds of things that Dr. Mosley talked about, are the upstream determinant of health of society. So this is the US edition, the UK edition. Equality is better for everybody. More equality is better for everybody. And what they did was they aggregated Z-score indices of a variety of conditions that we think would be good to have: longer lives, lower infant mortality, fewer teenage births, obesity, and you name it. And with Z-score indices plotted versus income inequality from low to high, smaller gap countries have better of just about everything. So the challenge to us is to see whether or not this is true, because you shouldn't believe anything I've told you. I can make it all up, but you have to verify it for yourself. Now, a study done from Harvard in 2009 said, it was a meta-analysis of all the inequality health studies, and they said, how many fewer deaths would we have in the United States if we had the income inequality of the healthy Scandinavian countries? That is a Gini coefficient less than 0.3. Turns out 883,000 fewer deaths would occur in this country. That is 1 death in 3 in the United States can be attributed to our high income gap. Again, these kinds of studies receive no press in this country. Aggregating indices of child well-being from the UNICEF Innocenti research studies shows the United States with very poor outcomes for children in so many indicators, also related to our high income inequality. I want to change gears now and try and suggest that it is early life when these factors matter most. That is, there's a whole host of research and findings that support the developmental origins of health and disease. That is, as you go from the erection to the resurrection, that is the period of time from conception to before you go to school, those critical early years. During that period of time, roughly half of our health as adults is programmed. Roughly half of our health as adults is determined in this very early period. Now, I try to think of ways of conceptualizing this for people, and if you think about it, you began life as a fertilized ovum. Where was that ovum produced? The ovum was produced in your maternal grandmother's womb, right? Your mother was born with all the ova she will ever have. So your maternal grandmother's circumstances have to affect your health. Then that fertilized ovum divides roughly 42 times to produce a newborn. Cell division is a critically sensitive period of time that can be influenced by all sorts of environmental drugs, toxins, and stress, and the studies show that very well. There are only a further 5 cycles of cell division from the newborn to you sitting in this room. So what would you bet on, the first 42 cycles or the next 5? I'd pick 42 any day. So that's really critical to understand physiologically and developmentally why the early years are so important, because that's when all the programming is going on. And we can look at the stress physiology behind that, and we can look at the fetal placental maternal unit and see how when the mother is under a lot of stress during pregnancy, then the fetus is exposed to a lot of cortisol. And all of you in this room know that if you're faced with the imminent delivery of a preterm baby, you give the mother prednisone to mature the fetal lungs. And that's what the fetus is doing. It's seeing the world outside there and saying, hey, it's going to be a tough life. I better mature my organs early, so if I pop out, I have a chance to survive. So how can we look at these early life issues? There's a lot of natural experiments now. People who were near ground zero on September 11th, they had higher low birth weight and they had preterm deliveries, all associated, I think, and this is being followed, to the stress of being in that environment. Similarly with Hurricane Katrina. That is, being exposed to the stress of that going on really compromised and you were pregnant, compromised your baby's outcomes. The best study, the best natural experiment, was the Dutch hunger winter. From November 1944 to May 1945, rations went in Holland from 1,800 calories down to 900 calories. And so we were able to look at the fetuses in utero during different periods of that famine, and then find that those who were nutritionally stressed in the first trimester had most of the metabolic syndrome and chronic diseases of aging as they got older. They had more mental disorders, more breast cancer, more sensitivity to stress, because your stress mechanisms are programmed during that period, in mid-gestation and in late gestation. And so trying to recognize the importance of this period by both a variety of experimental studies, by natural experiments, is really critically important. So poor pregnancy conditions are impacted not just by the life history of the woman before she got pregnant, by your parents, by your grandparents, and we are learning that previous generations, and we have studies suggesting that the current low birth weight of African Americans in the United States is actually an intergenerational transmission of the effects of slavery that Dr. Mosley talked about. So all of these poor pregnancy conditions result, basically what's happening is the fetus is trying to figure out how can it survive to reproduce, because that's our purpose in life, to reproduce, then the community can take care of the issue. And then this programming produces most of the chronic diseases that we have of aging. And our attempts to treat chronic diseases are not as successful as we might otherwise think. So you have a paper from the New England Journal that's by Gluckman summarizing a lot of these early life issues, and I just want to point out one thing. Looking at a Helsinki birth cohort, namely that low birth weight babies, and there's a gradient here, the lower the birth weight, the worse the outcomes, followed by rapid catch-up growth in the first 10 years after you're born, means you're more likely to have a coronary occlusion later in life. This has been related to diabetes, to hypertension, to a whole bunch of issues, and this is now called variously the Barker hypothesis, the fetal origins perspective, the developmental origins of health and disease. And so most of our chronic diseases of aging, a strong argument can be made, are related to these early life issues. And chronic renal failure that Dr. Mosley talked about, it's really fascinating to look at how the kidney develops in utero and how many nephrons it has, how this is impacted by stress, and then you pay the price later on in life. So a lot of these conditions are there. Our challenge is to understand them and do something about them. Inequality has biology behind it. Poorer people are going to have poorer outcomes with medical care, and it's not due to their behaviors. A study from Boston Children's Hospital pointed out that if you look at pediatric heart transplant recipients, if your parents were poor and you got a heart, you're more likely to reject it than if your parents are rich. And this is before you do any behavioral kinds of things. These are critical issues, the gradient. You can see this with organ function everywhere. I asked you to take a deep breath at the beginning. If I'd asked you to blow it out as fast as you can, we'd measure your FEV1. Who's going to have higher FEV1s? Rich, of course. Poor people are going to have lower FEV1s. This is true for pretty well every organ we can study, namely poorer people's organs function poorly. And this is programmed early in life, and it's a legacy of previous generations. So we can look at a life course model. As I said, as we go from conception to death, this is patterned on the British birth cohort 1958 study, where we took everybody who was born in the first week of March in 1958, and we've been following them serially ever since. And we find that latent factors, namely your birth weight, circumstances around birth, your parents' socioeconomic status, how much you grew in the first 7 years, that those factors are every bit as important as the pathway and cumulative factors, that is, how many cigarettes you smoked, how many times you got rip-roaring drunk, and the cumulative factors, whether you went to Cambridge or whether you didn't graduate from high school, the pathway factors. These two put together have the same strength in health outcomes later in life as these early life factors. So they are critical. What are we going to do about it? What's our responsibility? Well, if stress in early life is so important, we should grant parents leave, paid leave. All the other rich countries grant you at least a month of paid antenatal leave if you're pregnant. The United States does not. Only 4 countries in the world do not give you paid parental leave, maternity leave. United States, Swaziland, Liberia, and Papua New Guinea are the only 4 countries in the world without a paid maternity leave policy. That's something else we can change. That's our responsibility. So I'm suggesting that what we need to do is primordial prevention, change the circumstances of life early on. Recognize that it's going to take generations to see changes. We used to be one of the healthiest countries in the 1950s. It's taken us a few generations to slide down. We always want a quick fix. That's not there unless we invade all the healthier countries, and we can't do that with our military strength right now. We're going to have to wait a few generations once we get the principles in place to promote early life. And if you're interested in this, there's the 7th International Congress on the Developmental Origins of Health and Disease is being held in Portland in September. It's a really exciting research conference where all these studies that underlie the points I made are presented. And just preceding that, up just 100 miles north, if you remember, Canada's much healthier, they're having a conference on what are we going to do about these ideas? How are we going to seed these into countries? How are we going to get action on the developmental origins of health and disease? So I'll leave you with these to basically say, we all die young for living in this country. African Americans do worse than the rest of us. But once we recognize that our health status really depends on these structural factors, and we do something about it, then things will change, and that's our challenge.